Welcome back for another deep dive. Today we're going to be talking about, well, a bit of a sensitive topic, but very important, especially for cat owners. We're going to be looking at the quality of life for cats that have paraplegia or paraparesis and also urinary retention.
Yeah.
So both in homes and in shelters. And we're looking at a recent study from the Journal of Feline Medicine and Surgery that's kind of looked at this in a really interesting way.
It is a really unique approach. A lot of the times we focus on the medical management of these conditions, which, is important. But this study actually looks at what it's like to live with these conditions, both from the cat's perspective and from the caregiver's perspective.
So how did they go about gathering this information? That's got to be really difficult.
Yeah, assessing quality of life in animals is a really challenging thing to do. But the researchers took a really interesting approach. They did two things. The first thing they did was observe cats directly.
Oh, cool.
Yeah, and they looked at cats in both home environments and in shelter environments. And during these observations, they paid really close attention to things like the cat's posture, their movements, how they interacted with people and with their environment, and any signs of discomfort or distress.
So they were really looking for those subtle cues.
Exactly. Like, how is this cat actually feeling?
Yeah.
The second thing they did was they surveyed the caregivers. So they talked to both owners and shelter operators, and they asked them questions about the cat's daily life, about the care routines that were involved, and any challenges that they faced.
That's really smart because you get both the objective view from the observations
Yeah.
and then also the subjective experience.
Yeah.
From the people who know these cats the best.
Exactly. And by putting those two together, you get a much richer picture of what life is like for these cats and for the people who care for them.
So I guess that brings us to, the big question.
Yeah.
Did they find that these cats with these conditions can actually have a good quality of life?
And the answer is yes. This study found that cats with these conditions can actually maintain a good quality of life.
Wow.
The median score that they came up with across all the cats that they observed was 64 out of 70,
Wow.
which is well above what is considered acceptable.
Yeah, that's amazing. And I think a lot of people, maybe even some vets, would kind of assume that a cat with these conditions is going to have a poor quality of life.
It's a common misconception, but the study actually found that that's not necessarily true. Now, it's important to note that there was some variation in scores, and they did find one significant difference, which was between cats who could still move their hind limbs, even if it was involuntary movement, and those who couldn't.
So some mobility, even if it's not completely controlled, still makes a difference.
Yeah, that's what the data suggests.
Interesting.
Yeah. And this distinction is really important because it highlights that while these cats are incredibly adaptable and they can thrive, supporting that remaining mobility, whatever it looks like, is really crucial for their well-being.
Yeah, that makes sense. Now, I'm curious about the comparison between cats in homes versus cats in shelters. I would think, being in a shelter with, less space, maybe less individualized attention, that it might be a little bit tougher for a cat with these challenges.
It's definitely a logical assumption. But here's where it gets really interesting. The study found no difference in quality of life scores between those two groups.
Wow.
So cats in shelters with these conditions were doing just as well as cats living in homes.
That is really surprising, I've got to say. It says a lot about the quality of care that they're getting in those shelters.
Yeah, it does. And, the authors of the study actually highlighted this in their discussion. They really praised the dedication and the expertise of the shelter staff. They're going above and beyond to make sure these cats are getting really good supportive care.
So we know these cats can do well. But what about, the people on the other side of the equation? The caregivers. I imagine caring for a cat with these conditions is, it's got to be pretty demanding, both physically and emotionally. So did the study look at kind of the caregiver experience?
They did. That is the burning question, right? What's it like to actually care for one of these cats? And the study really delves into that in quite a bit of detail. So in the next part of our deep dive, we can get into that.
Yeah, let's do it. Let's talk about, were caregivers overwhelmed by the amount of care that these cats need? Did they regret taking on these cats? What did they find?
Well, let's start by talking about why bladder expression is so important for these cats.
Yeah, that's something we should probably clarify for our listeners because it's such a fundamental part of their care.
Exactly. So paraplegia or paraparesis, paralysis or a weakness in the hind limbs, it often affects the nerves that control bladder function as well.
So the cats can't urinate normally on their own.
Exactly. And without that ability to fully empty their bladder, these cats are at really high risk for developing some serious problems.
Like what kinds of problems?
Well, things like urinary tract infections, bladder stones, and even in severe cases, it can lead to kidney damage.
Wow. So bladder expression isn't just about keeping them clean and dry. It's really a medical necessity.
It is. It's about preventing those complications that could really severely impact their health and their well-being.
So the study mentioned that both shelter operators and owners predominantly use manual expression techniques. Did they get into the specifics of how that's done?
They did, and they found that while most caregivers were relying on manual expression, there was a pretty wide range of skill levels and techniques being used.
Yeah, I can imagine. I mean, it's a skill that, people might learn through different channels. Not everybody's going to have like formal training on it, right?
Right. And the study actually pointed to that as an area where there's room for improvement. They emphasized how important it is to have standardized training for bladder expression, ideally led by veterinary professionals.
Oh, that's interesting. So, a vet or vet tech could guide caregivers through the proper techniques, make sure they're doing it safely and effectively.
Exactly. Because not only could that improve the quality of care, but it could also boost caregivers' confidence.
Yeah.
Make them feel less anxious about performing this essential task.
Yeah, it's all about empowering those caregivers with the knowledge and the skills they need to feel comfortable and competent.
Exactly. And it's not just about bladder expression, right?
Right.
The study also touched on the importance of monitoring for urinary tract infections, which unfortunately are pretty common in these cats.
Oh, I bet. And that's another challenge for caregivers because how do you spot the signs of a UTI in a cat that, maybe already has mobility issue?
Yeah.
What are you even looking for?
Yeah, that's the crux of the matter, right? And so the study authors, they suggested some really simple monitoring tools that caregivers can use.
Okay.
Things like, litmus paper or urine test strips.
Well, that makes sense. Those are easy to find.
Yeah.
Easy to use even for somebody who, doesn't have a medical background.
Exactly. And they can give you some really valuable information. Things like the pH of the urine, whether there's blood or protein present, which can all be early indicators of a UTI.
So caregivers can be proactive
Yes.
in monitoring their cat's urinary health, catch those potential issues early on.
Exactly. Because early detection can make a huge difference, in preventing a full-blown infection and minimizing the discomfort for the cat.
Well, speaking of discomfort, I'm curious about the types of injuries that led to these cats' conditions in the first place. Did the study shed any light on that?
They did. And, it's a little bit sobering, but the findings are a good reminder of how important it is to keep our feline companions safe. So the leading cause of spinal cord injuries in these cats was trauma. And the most common type of trauma was falling from heights.
Oh, no, really?
Yeah.
That's so sad, especially because they found that over a third of these cats experienced their injuries within their first year of life.
Yeah, those early months and years are so critical. They also saw cases resulting from things like vehicular accidents, firearm-related injuries, even dog attacks.
It's a reminder that, accidents do happen, but there's a lot we can do to, create safer environments for our cats.
Exactly. Simple measures like securing windows and balconies, keeping cats indoors, supervising interactions with other animals, it can all make a huge difference in preventing these devastating injuries.
And while trauma was the primary cause, the study also mentioned other potential contributors, right? Like degenerative neurological conditions.
Right, so it's not always about something external. Sometimes these conditions can develop from internal factors as well.
Which just underscores the importance of seeking veterinary care if you notice any changes in your cat's mobility or urinary habits, even if you haven't seen a specific injury.
Absolutely. Early diagnosis and intervention is key, no matter what the underlying cause is.
Okay, so shifting gears a bit, I was really touched by the study's findings on adoption. It seems like many owners adopted their cats knowing full well about these conditions.
Yeah. It really speaks to the compassion and the willingness of these people, to open their hearts and their homes to cats with special needs.
Did they, explore the motivations behind these adoptions? What prompted these owners to choose these particular cats?
Well, it's interesting. A lot of these cats were already showing signs of paralysis at the time of adoption.
Oh, wow.
So it wasn't something that was, hidden or revealed later on.
Right.
Potential adopters could actually see, the challenges that these cats face.
Yeah.
And here's the really remarkable part. A lot of these owners were actually given unfavorable prognosis by veterinarians
Oh, wow.
who basically said, these conditions are incompatible with a good quality of life.
And yet they still chose to adopt.
They did.
It's amazing.
Yeah.
So even in the face of doubt and skepticism, these owners really trusted their instincts and gave these cats a chance.
And you know what? The study's findings show that they made the right decision. These cats are thriving in loving homes. They're defying expectations and proving that a diagnosis doesn't have to define a life.
That's a beautiful thing to hear. Now, this is all great news for cats that have found homes. But what about the cats who are, still waiting for their forever families? What did the study say about their experiences in shelters?
Well, that's a really great question. And it actually brings us to another really important finding from this study. They found that shelter cats with these conditions can also have a good quality of life.
Oh, that's important. Because, it's easy to think that a home environment is automatically better. But the study's showing that shelters can provide excellent care as well.
Yeah, they can. And, it really underscores the hard work that shelter staff are doing every day to make sure that all the animals in their care, regardless of their needs, are well taken care of.
Yeah. It really is a testament to their dedication, their compassion, and their expertise. Did the study talk about any ways that shelters can best support these cats?
Yeah, they did. They talked about how important it is to educate potential adopters about these conditions.
Okay.
Dispel any myths or misconceptions, and really showcase the unique personalities and the potential for joy that these cats have.
It's all about breaking down those barriers.
Yeah.
Right?
Yeah.
Showing people that these cats can be amazing companions.
Exactly, because by providing that accurate information and addressing concerns openly and honestly, shelters can empower those potential adopters to make an informed decision.
Yeah.
Maybe even consider opening their hearts and their homes to one of these deserving cats.
And it's not just about finding a home, right? It's about making sure there's a successful transition, a lifelong bond.
Right. And the study actually suggests that shelters can play a big role in that transition by offering some resources and support to both the cat and the adopter, even after they leave the shelter.
Oh, that's interesting. So what kinds of resources are we talking about?
Well, they talked about things like providing training in bladder expression, guidance on how to create a safe and accessible home environment for the cat, and even connecting adopters with veterinary specialists who can provide ongoing care and support.
So it's really like going that extra mile to set up both the cat and the human for success.
Exactly. It's a holistic approach that recognizes how important ongoing care is and how valuable a strong support system can be.
This is all so inspiring. I mean, it's clear that with the right care, support, and of course a whole lot of love, that these cats can live full and happy lives, both in homes and in shelters.
I completely agree. This study is a great reminder that every cat, no matter their physical abilities, deserves a chance to experience love, to experience joy, and to have the comfort of a caring home.
This has been a truly heartwarming deep dive. So as we wrap things up, what are your final thoughts?
Well, I think we've covered a lot of ground today. It's been a really fascinating deep dive.
Yeah, I, for one, have learned so much. So I think just to kind of, wrap things up for our listeners who maybe just tuned in or just need a little reminder, what are some of the kind of key takeaways from this study that we've been looking at?
Well, I think the biggest one is that it really challenges that common belief that cats with paraplegia, paraparesis, and urinary retention, they can't have a good quality of life. The study actually shows that these cats can and do live well, but it all comes down to the care they receive.
And that care involves a, multifaceted approach, right?
Yeah.
We've got to be thinking about their physical needs, but also their emotional needs.
Exactly. So bladder management, particularly that manual expression we talked about, that's absolutely crucial. Got to keep those urinary tracts healthy.
Yeah. And standardized training for caregivers so that they can do that bladder expression correctly. That can make a world of difference.
Oh, absolutely. And, we also have to remember that these cats are individuals. What works for one might not work for another. So we really need to be tailoring their care to those specific needs.
Yeah, you're so right. It's not, one size fits all kind of thing.
Yep. And that individualization extends to their environment as well.
Oh, yeah, of course.
We got to make sure they have a space that is safe, that's stimulating, that's accessible. That way they can explore and interact and really just, enjoy their lives.
So it's about that physical care, but also like the emotional enrichment. Give them the opportunity to thrive.
Exactly. And that's where the human element comes in. I mean, the study really highlights how dedicated both owners and shelter staff are in providing this kind of comprehensive care.
Yeah, it's really amazing to hear about, those owners who adopted these cats, despite being told, like, maybe this isn't a good idea.
Yeah.
And those shelter workers, just working so hard to make sure that these cats are getting the best care possible. It's really inspiring.
It really is. It shows you how powerful the human-animal bond can be and how it can really make a positive impact on everyone involved.
This has been just a really heartwarming episode, I think.
Yeah.
It shows the resilience of these cats, the incredible love from their caregivers, and just that potential for, joy and fulfillment, even when things are tough.
I completely agree. And as we wrap up here, I think it's worth leaving our listeners with kind of a thought-provoking question that the study itself raised. What other professionals beyond veterinarians could be involved in supporting these cats and their families?
That's a great question. We talked a little bit about the role of physical therapy,
Yeah.
helping with that mobility.
Exactly. That's one example. What about trained caregivers who can provide in-home support? Especially when owners are first starting out, maybe still learning how to do that bladder expression or other care tasks.
Yeah, that kind of support could make such a difference for those new owners. Make them feel more comfortable, confident that their cat is getting the best care.
Exactly. And it just shows you, there's so much potential to expand that support network for these cats and their families. Hopefully this study will, lead to some new ideas, some new approaches, and even inspire more people to get involved.
That's a wonderful thought to end on. A future where these cats and their families have all the resources and support they need to really thrive.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.